Autism is currently defined as highly variable neurodevelopmental disorder. It varies from person to person. Its manifestations vary from person to person. What are the symptoms of autism? Little eye contact, distinct reaction to stimulus like light, smell, taste, noise, very special, very specific interests, repeating words, repeating phrases, repetitive behavior, non-verbal communication, communication without speaking, without sentences, without words, delayed language development, intense reaction to minor changes in routine and in surroundings, in atmosphere. Autism, also called autism spectrum disorder, ASD. It is a developmental disability. Many people with ASD, with autism, can be treated even if they grow up or even if they are old enough when diagnosed. And symptoms of autism first appear at the age of 12 to 18 months, age at which autistic children begin to speak varies. Kids usually start speaking at the age of 12 to 18 months. Autism symptoms have generally been found to improve through childhood and through adolescence. What are the causes of autism? Nobody knows what is the cause of autism, but some researchers, some scientists have interpreted as inherited disorder. Some have associated it with the air pollution, especially during pregnancy. What are the goals of treatment? Is to maximize your child's ability to function and supporting development and learning. There are two levels of autism. Level 1 autism is requiring support, and level 2 autism is limited verbal ability. Among the genetic causes, it is said that 60%, 66% of genetic material comes from the father. What one other autism syndrome is small autism syndrome, also called Sennett syndrome, also called high functional autism. This is a condition, not a disorder, not a disease. And there are extraordinary skills and there is extraordinary memory in these children. Best age to treat is 2 or 3 years of age, and in adolescents, those who are 16 plus age, to diagnose, there is a self-administered 50-question questionnaire. Autism patients, autistic children can have a normal life. Why autism is so common now? Because of increased awareness, increased diagnostic criteria, that is clinical observation of behavior, clinical observation of development, increased screening tools, increased screening processes. There's one question: can anybody work with autism in any school, in any office, during his daily life, during his life, yes, can work. For his sport, for his sport of his life, he can work. He or she can work. And what are the treatments? Behavioral approaches. There is one special approach is applied behavior analysis. According to some scientists, it is useless. CBT, cognitive behavior